I am now 8 months pregnant, and over the last few weeks I have been seeing Dr. Michelle here at UPHealth Hong Kong, and she is a chiropractor. So today we are just going to talk about some postural changes that happen during pregnancy and how chiropractic can help with that, relieve pain, and we're going to look at some of the equipment that you use to help with the pregnant body. So over to you.
Thank you. Hi everyone, my name is Michelle. I'm a chiropractor. Today we're going to talk a little bit about how the body changes during pregnancy. As we all know, to accommodate for the baby and the growing baby, the woman's body go through all sorts of changes. On a spinal perspective, a lot of it is around the effect of relaxant has on the body. It is an important adaptation for the body. It obviously needs to make room for the baby, but from a spinal perspective, because that relaxant affects the ligaments and the tendons, it makes your joint actually more loose, but at the same time also more unstable. And also with the growing baby and the increasing of the weight means your body is dealing with more pressure. So that also puts that extra stress and pressure onto the joint, which now is also more loosened and a little bit more unstable. So this is the reason that over 50% of women experiences back pain during pregnancy, and that probability actually goes up with subsequent pregnancies. The spine has three curvatures, and this is looking at the spine from the side. The curvature is an important part of the spine because it actually acts like a spring. So it takes over and takes care of some of the body weight that is naturally going through the spine. So it deals with things like jumping around, doing exercises, bearing weight. During pregnancy, because the relaxants are affecting the ligament, as we discussed, and also a lot of that growing bump is concentrated in this area. So most women will also experience an increased curvature in the lower back. So that sometimes will give you more aches and pain in the back due to that pinching effect. But actually this needs to happen regardless, because from a physical perspective, the baby has to go forward. There's no room for the baby to move into from the back perspective. So that increased lumbar lordosis is a common posture pattern that we do see with pregnancy. And also, the pelvis at the same time changes, and the weight adaptation also changes as a result of it. Do different protocols to adapt for the pregnant body, and depending on how far along the pregnancy, that adaptation also changes. So the technique we utilizes will be actually tailored to the person. So that will really depends on what the presentation is for the person, how sensitive is that body, and that's how we adapt visit to visit, how much we need to do. Use pregnancy pillows, and then these are actually just made for chiropractic. So it's basically a nice latex mixed with memory foam material, and it does have a cutaway, so it's got a hole in the middle. So when we're getting our patient lying on top of this, essentially the belly is fully suspended in this hole, and when you do lie down, you really shouldn't feel any kind of pressure on the bum whatsoever. So it is a very comfortable and very, very safe position to be in. A lot of the technique we use is manual based, which means we use our hand to do adjustments or movements to the body itself. We also use this tool, which is called an activator, and it just creates a little tap and a little bit of an impulse at the front. So this is also a tool we use for areas that we want to be just super gentle on. So we will use it to guide the joint into the position we desire it to go to. So it's just a nice gentle way, it's a very controlled way to adjust. And on some clients, if they're extra nervous, if they're really concerned about any kind of hands-on treatment or manual treatment, we actually switch to this just because it's much lighter. In some instances, we adjust the pubis actually during pregnancy, because
which I've had a lot this pregnancy. Pubic pain.
Pubic pain,
yeah.
Very, very common. And that's also to do with the pelvis essentially being out of alignment, and again stretched, similar with what we were discussing before, because the relaxant affects ligament and cartilage.
That's just some basics on some of the equipment that they use here at UPHealth for pregnant women. If you would like to book in for chiro, please do with Michelle or her colleague Jillian. They are fantastic and have been doing it for years, so you're in safe hands.
Absolutely.
See you next time.